Good morning, this is Wendy Watkins, and she has offered to do an interview with us. Thank you, Wendy.
You're welcome.
And what we're going to talk about, I'd like to ask you a question. First of all, are you familiar with the term ableism?
Absolutely. I hear it a lot in the field that I do. I'm a Family Support Services Coordinator for EOP, assisting families and individuals with developmental disabilities. So ableism is a term that I'm very familiar with because I do help families that have children with disabilities and individuals that have disabilities. So actually I like the term ableism much more than I like the term disabilities, because really it shows the strength that someone has that has a disability. We should be looking at their abilities rather than their disability.
Great information, Wendy. So what are your roles and your duties in your profession?
Well, what I do is our funding comes from the Office for People with Developmental Disabilities. So what I do is I'm an access coordinator, which is when a child or a professional who works with a child with a developmental disability sees that they need support services, they will do a referral to me. So I am actually the access person to getting the documentation and helping them into the OPWDD system for supports and services. So we have, once the eligibility is determined, we have a recreation program here that serves individuals, and also family reimbursement, which is a great tool for families who have someone with a disability, because it helps to reimburse for respite services and adaptive equipment, gluten-free, casein-free diets for those children who that is recommended by their physician or nutritionist to improve their quality of life with a diagnosis of autism.
Great. Wendy, do you feel that families utilize the services that are available in our county?
I do believe that they make very good use of utilizing the services that we have in our county if they are aware of them. And basically that is the importance of all of the community providers and partnerships that serve families and children, that the word gets out there collaboratively of the services that you offer and what you can do for families. And I think that we do a pretty good job of that here in Chemung County. So I can say personally that I serve about 75 families a year.
Okay. When do you feel services should begin if a child has been diagnosed with a disability?
As early as possible. So a great community partner of mine is early intervention. And those ladies that work in early intervention do a lot of referrals, give a lot of referrals to me, and the services that they provide are hugely and extremely needed here in our county, and they are the first step in home of providing services to young children, such as speech, OT, PT therapy. This has been shown to be the needed treatments for children to have success and productive outcomes, and help them to live a good quality of life because of the services that they're getting early on.
Great. What are some of the disabilities that you see? Could you give us an example or so?
Absolutely. We serve families and individuals who have cerebral palsy, severe seizure disorders, also known as epilepsy, neurological disorders such as traumatic brain injuries that occur before the age of 21, autism, and also mental retardation.
Okay, what advice would you give to parents that have a child with a disability?
To reach out to the supports that you have in your community. And how you do that is linking up with early intervention programs, look for support groups, ask your teachers, Reach out to other parents that you see that have a child with a disability and say, where do you get your supports from? And one of the nice organizations that we have here that really helps support families is Parent to Parent of New York State. And through that, a parent who has a child with a disability can connect with the supports both educationally, educational information, and to supports of other parents who have a child with a very similar type of disability that can offer supports for them, and support groups. And we have that here at EOP, support groups to help families, and offer workshops on a quarterly basis with the input from parents to what they need to know.
Great information.
Okay.
Do you feel that families that have a disabled child are discriminated against?
Absolutely. Not only do I work in the field of developmental disabilities, but I also am a parent of a 26-year-old daughter that has a disability. And you see it not only when they're a young child and you're needing services and supports, but you also see it basically all through their life, teens and as adults, how the main population and community treat them. They're fighting for community inclusion and the rights for them to be able to participate in community events, and also in the workplace and employment.
Great. Wendy, what advice would you give to create awareness to families that don't have a disabled child?
Get to know a person. Get to know a person first for who they are, you know. Reach out and become involved in organizations that serve people with developmental disabilities. Learn about it. Knowledge is a great tool, and then once you get to meet people, you know, you'll see why you're missing out if you don't know somebody that has a disability.
Okay. What if you had a magic wand, what would you do to help combat ableism?
Well, first of all, I would get rid of the word disabilities because often we have just way too many labels, you know, for everything that we have in life. And again, going back to looking at a person for who they are and looking at their strengths and their abilities, getting to know them for who they are, and just mainly shaking that wand around and saying, okay, we don't know the word disabilities anymore. We're looking at abilities for people, all people.
Great. Thank you very much,
You're welcome.
Wendy.
Thank you.